Amy Devi. Welcome to my YouTube channel where we talk about health matters. And yeah, it has been long, it has been crazy, but I thank God we're here and we're gonna talk more about it. And I want you to really take this now seriously because the weeks that have passed, I have been in social media and I'm seeing like every day either 2 or 3 or 4 people are asking questions on social media and the answers, oh my goodness. For example, somebody's taking her child a photo and then he's asking, what is this? And when you look at that photo, it's either eczema, it's either heat rash, it's either a reaction to something. You cannot tell. If we really like our children, I'm humbly requesting that can we have a habit of getting into the medical checkup? Get a professional medical healthcare setup area, then ask your question. Another thing I saw on social media this week is somebody's having diarrhea and vomiting, and then he's asking, what medicine can I take? And the answers, oh God. Another question people are asking is they have, I don't know, the skin has an inflammation, and then they take it a photo, and then all the people are asking these questions is on Facebook, Instagram, Twitter. No, I think Twitter is not so much, but Facebook is so much. Kindly, and especially, what is this other thing I saw? For example, posting so much, you've gone to a healthcare professional, they have given you some medicine, and then you come take a photo, ask it on social media. On a very serious note, it's very good to ask people, but it's good to ask the right people. I came to realize, like, when you ask it on Facebook, in most cases, people on Facebook might not be knowledgeable in that line. So what they end up doing is they get onto Google, then they get answers, and then they diagnose, and then they treat. Medicine, people go to school to study medicine for so long. And before they even are set out to go and treat patients, they go through an internship class. The internship class takes, for example, for a whole year. And why we talk about internship is where the older ones mentor the young ones. So you work through a certain specialty for 1 year for you to be competent enough to manage a client. Another person was asking, I have bled twice a month. I have had my menstrual period twice a month. At what could be the problem? Oh my goodness. The answers. Some people are telling her it is because of the family planning you're using. Others are telling her maybe you are fertile. Others are telling her maybe you had sex so much. Seriously? That is a medical issue. Get to a hospital, seek for healthcare professional, see an gynecologist, obstetric gynecologist. Let me tell you for sure, these people go to school for 7 years to do medicine. Then they go for another 2 years to do major medicine on the human anatomy, especially the gynecological anatomy. So you cannot expect somebody who is just from Form 4, went to a career of engineering to answer such a question properly. They only know how to assemble cars and assemble computers and assemble, make a road, something like that. What again did I see? Again, I saw somebody asking a question. I have been on family planning pills, and I have I've been on family planning injection. I have not got my periods. I've been trying to get a baby. Seek professional healthcare. Social media will not have your answers at all. I'm here to tell each one of you Kenyans, the Kenya is has launched a pilot study of universal healthcare. And I can say universal healthcare, the only thing that's going to help us get there is getting onto preventive care mode. We cannot operate well when we talk about curative. Healthcare has like four, can I say levels? Where we do about curative, there is preventive, In preventive is you prevent a disease from occurring. When you talk about preventing a disease from occurring, is like you take every preventive action. You exercise, you prevent some chronic conditions, you take a proper balanced diet, you check what you're feeding, you go to the healthcare center to do a full total body checkup, and there's so many hospitals that are doing that currently in the country, in Nairobi and in Kenya. And yeah, that's all about preventive. And then you talk about curative. In curative, the disease has set in. So when the disease has set in, you go to a health care, a health setup to be treated. And if you were preventing this condition early, maybe you couldn't have got to the level of curative. For example, malaria. If we all prevent malaria, we will not go to hospital to be given second lines, like in a quinine. And you know, curative has some side effects, especially the drugs you're given. There are some side effects that comes with that drug. After talking about curative, there is rehabilitative. In rehabilitative healthcare, your ability for the body to do the work it used to do is now compromised. Now you need to be rehabilitated. You have to be made to adapt to the area that you've lost in your body. For example, we talk about diabetes. When you have diabetes, if you were preventing it, you could have done exercise and proper diet. You didn't. You got to the curative phase. You were supposed in curative phase to take medicine well and do everything properly. You missed doing that. Now it affects your eyesight. Now you're supposed somehow you lose your sight either in one eye or both. Now you go to another level of rehabilitative. You are blind. You can't see again. Now we have to make you be able to get on with your life in that state of health. You see now, the burden is increasing. The burden from preventive is less, then curative is growing, rehabilitative is more. From rehabilitative, now, there is that thing we call promotive care. In promotive care is when you promote good health habits, whereby there is a policy making, you by advertising, putting billboards, by teaching people. Social media cannot give you those solutions. Seriously, in every family right now in this country, I want to believe like there is somebody who is a healthcare professional. Not only that, in a very short distance from one area to another, you won't miss a healthcare professional. And even if it's further that you do not have consultation fee, I really feel like you can still have somebody to talk to. And let me give you a secret in healthcare. Myself, I'm a healthcare professional. Only that right now I am a healthcare professional, and right now in healthcare fully concerned with quality healthcare. I'm going to tell you this thing today morning, like in healthcare, some things come with experience. When I was a junior nurse, those days past, there are things I could not do. There are things up to now I can't do because of my level of experience. So whenever somebody handles you and they do not handle you with satisfaction, you have a right for a second opinion. Next blog I'm going to do is about your rights and your duties. One of the duties that you need to know is social media does not have solutions. Do not post like, my child has been having a fever, I went to hospital, I got I got an antipyretic, and then now the fever is still there. Social media does not have answers. By the way, people, I want to encourage you, everybody, be concerned with preventive healthcare and promote good health. Be very concerned. By the time healthcare gets into rehabilitative state, it is very expensive. The universal healthcare that was launched back in 2018 by the president of this country, which is being piloted in 4 counties, I hope you know, in Kisumu, in Nyeri, Isiolo, And which one? I remember. The piloting of universal healthcare. Universal healthcare in this country cannot be a reality if we are not concerned with the preventive healthcare. For example, how do you prevent maternal deaths? Give birth in a hospital. And please, in a hospital, not in those houses that people call themselves the beginner kiosk, whereby even if you walk in, infection control is zero. Ask them, just go and see even how those areas are set. They're so dirty that infection control is below average. I said a proper healthcare. How do you prevent some complications in a newborn? You do not take some supplements when you are pregnant. For example, folic acid to supplement yourself. Your baby misses some things, then you give birth to a child who has a congenital deformity because you did not prevent it. Mothers, on a very serious note, mothers, I am so here to tell you that you need to do that because that's all you need.